Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
How to open different regions. First, head. The incision is made one in the mastoid process and from one mastoid process to another mastoid process in the coronal plane on the skull, and anterior flap of the skull is pulled down up to the occipital protuberance. Skull cap or calverin is exposed. We then open the skull cap in a V-shaped manner. When skull cap is opened and examine the brain, then skull cap has to be fitted and sutured. V-shape removal makes easy to fix it to the back. When skull is opened, then dura mater is opened along the lines of opening of skull cap. So dura is opened and rolled back and brain is viewed. Then pass the four fingers between the brain and the skull at the frontal lobes and left of the brain and cut the attachments of the brain to the cranial cavity, and the brain is taken out.
thank you and thank you for watching.